patented, clinically proven, compliant OSA treatment. It's as simple as SomnoMed. Sleep disorders affect at least 20% of your patients.
1 out of every 5 patients that comes in the office has a sleep disordered problem. Even more than that will snore on a regular basis. Up to 40% will snore every night.
That's a huge market that Dr. Kent Smith doesn't want to miss out on.
All of our patients are effectively screened for any type of sleep breathing disorder.
His appliance for treating those with obstructive sleep apnea and snoring, the SomnoDent MAS.
We love the effect it has on our patients.
The SomnoDent MAS treats obstructive sleep apnea by advancing the mandible forward, thus opening up the airway.
This is what it looks like. It has wings that will hold the mandible forward and holds the tongue forward.
It's a design that SomnoMed Executive Vice President John Truitt is very proud of.
Our device is unique in that it does not lock the upper and lower jaws together.
The SomnoDent MAS is custom made for each individual. It consists of an upper and lower dental plate and a unique patented fin coupling mechanism.
In the treatment of obstructive sleep apnea, if one can take the mandible or lower jaw and advance it to the correct position forward, you can mechanically splint the airway open, thereby stopping snoring and, in many instances, effectively treating obstructive sleep apnea.
The appliance is fully adjustable, providing incremental lower jaw advancement to the necessary degree, depending on the distance required to reduce or eliminate obstructive sleep apnea.
There are adjustment screws here on each side that we use a little key to move, and each time we move it 1 turn, it adjusts it forward 0.1 millimeters.
The appliance comes in 2 different linings, acrylic and the unique SMH B-Flex material.
This is our flagship product. This is the SomnoDent MAS Flex. The Flex refers to a soft liner against the dentition, it's against the teeth. The advantage of this device is it's more comfortable. There are no clasps that are in between the teeth, which means basically the patient's going to hopefully be more compliant with the device. It's easier to wear.
SomnoMed also manufactures the SomnoDent MAS Edentulous for patients with no upper teeth.
I love the oral appliances because they're so comfortable for patients, and compliance goes up.
Unlike with other devices, the SomnoDent MAS allows the patient to fully open and close their mouth.
No matter how much you open your mouth, your jaw stays in a forward position.
The patient can fully function. They can open and close their mouth. There's more room for the patient's tongue. It's far more comfortable.
Research proves comfort equals compliance, and the SomnoDent MAS is the most comfortable appliance on the market.
I think what determines whether an appliance is going to be effective is if the patient wears it or not.
So when patients use it, they love it.
Many patients, after 1 night, say they feel tremendously better.
The SomnoDent MAS is less intrusive than the alternative, the CPAP, and it not only alleviates sleep apnea, it improves the patient's quality of life.
The first report we usually get is, oh, I can sleep with my spouse again. I'm not snoring anymore. I'm not making noise. And so that alone is a big boost.
To be able to meet those people and see how they develop over the weeks and months after having the device is greatly rewarding.
These results are achieved by the education that SomnoMed provides dentists and sleep physicians, helping them learn to work together.
SomnoMed highly encourages and in fact actively promotes relationships in between dentists and board-certified sleep physicians.
The SomnoDent MAS is a patented, clinically proven, compliant OSA treatment. Each appliance comes with a warranty against breakage, and SomnoMed uses the highest quality construction.
We provide what we believe is the leading product to treat obstructive sleep apnea.
That's a statement that SomnoMed is confident they can back up. Just ask Dr. Kent Smith.
We love the effect it has on our patients.
Or better yet, try SomnoMed for yourself. For more information, please visit www.somnomed.com.